So Ransford, who is a young football academy player, died at age 16 earlier this year. It was alleged that Ransford was sodomized by his coach Ibrahim Anyas and that the sustained trauma affected his health and emotional well-being, leading to his eventual death. Let me tell you some health risks associated with being sodomized. The first health risk when you have anal sex is, of course, sexually transmitted infections. You can easily get an STI through anal sex than at a male or female sex organ. The reason is that the walls at your anal area easily break during anal intercourse. The breakage is accelerated when you don't use a lubricant, and this provides access for the bacteria that causes gonorrhea, syphilis, chlamydia, and also the human immune virus to easily enter your body. This is why when the world became aware of HIV in the 80s, more gay men were getting the disease as compared to straight people, and people even thought that the disease was a gay disease. Again, unlike the vagina, the rectum or anal area has no lubrication upon arousal. So, if you pass there with penis, the tissues of the person receiving can break and the person can bleed easily. Also, the movement of penis in someone's anal area can cause tear or split like this. It is called anal fissure and it can cause pain during and after bowel movement or when you deshank. Moreover, if Ransford had piles or hemorrhoids, the anal sex could irritate the swollen blood vessels, which can be very painful. In rare cases, then if you chop your ass, you go get anal fistula, which is unnatural. And it is both painful and uncomfortable. One reason you can get anal fistula is when you have untreated STI through anal sex. Who knows whether this man had an STI or not? Let's look at how the mental picture of Ransford was in this case. It was a collage of memories, emotions, and distorted self-perception. The coach, who was supposed to be his mentor, role model, and protector, was now a figure of terror and betrayal. On the pitch, during training sessions or during games, where all the players are, he was encouraging and charismatic. In private, he was a violating figure. And all this was being played in the mind of Ransford since the beginning of the bottles piping. Ransford was obviously scared, confused, and struggled with self-worth and trust. It is important for you to know that the full autopsy report of Ransford is not yet out, but I am talking about the damage that he possibly went through alone. Joy News are saying he fell into coma before his death, and according to Ghana police on Twitter, Ransford had issues with kidney and liver, so we need more information at the moment. This is sad. May his family find strength in these trying times, and may Ransford himself rest in peace. What is left for us to do is to fight for justice now. Thank you for watching. Subscribe to this channel and don't forget to follow, like, repost, and share. Stay safe.